So here's a little clip, courtesy of @TrumpWarRoom. What a lovely name for a channel. Of Bernie Sanders speaking at what seems to be a Univision Noticias town hall. Univision Noticias being a Spanish-language cable news channel for Hispanic and Latinos in the United States. He's asked a question by what I guess is a local math teacher. Let's take a listen.
Senator Sanders, I'm a math teacher and I love polling data. Whether it's good or bad, I love polling data. Based on some recent polling, that based on Democrat voters, more than half of them prefer to keep their private health insurance. Even though Medicare for all, if Medicare for all was an option, would you give them that choice?
Nope.
Nope. It's the perfect answer, right? It's great. Now, let me be pretty clear. I'm going to fawn over Senator Sanders a lot throughout the career of this YouTube channel up until the election, I'm sure, unless he does something. But let me be very clear why there's a very serious reason, that underlies my support of him. And that is integrity is very important. And Bernie Sanders, of anyone running for president in 2020, has the integrity we need in a candidate, right, if we want any chance of actual internal reform. Otherwise, there's no guarantee. It's just a roll of the dice, right? You have to look at historical voting trends to see who is our best, who is the progressives' best option. And it is very clearly not Kamala Harris, Elizabeth Warren. And although there's some other progressive candidates on the ticket, you could argue they aren't polling high enough in this early stage, I think, to justify the additional effort, right? Effort at these early point in the game is very important. Is momentum. That's why the Bernie Sanders volunteers, fundraising numbers, and all that are more important right now than polls. Polls are obviously important, right? We can't ignore them, but this is the early game. We're nearing the mid game, around the third and fourth debates after people start to drop out. That's when things will start to really unfold. All right, so now that that's out of the way, let's talk about Medicare for all. This question is asked a lot, right? Why should we give up private health insurance? Why should we force people to give up their ability to choose? Why should we force people to give up the health care that supplies for them now? A common argument you could make that I hear all the time from folks on the left is that, no one actually likes their private health insurance. Ask anybody, and they would say that they despise it. And they would obviously also point out, that Medicare is the most popular health insurance provider in the United States, right? Because it's easier to apply because a wider number of people accept it, right? There's a whole slew of medical healthcare providers that accept Medicare and Medicaid, but that that you can't access because they're outside of whatever network you're using, right? That's a big argument. But I think there's some other arguments to be made that are made less often. One of which is the reduction of administrative burden, right? And that's pretty significant. This is where you get into this is why you have people advocate for things like universal basic income, for instance, is that it reduces the amount of administrative bloat. And I've been an administrator for quite a while, and I can tell you that it is a terrible – bureaucracy is a nightmare. It's not good. You think filling out forms is bad? Just think about working in a bureaucracy, okay? You're basically just making shit up as you go, basically interpreting laws at a point, because you're just two low-level bureaucrats who are unskilled, and you look at these policies made by some lawyers, and you're like, yeah, I think this is how this is supposed to read. But anyway, so reduce that as much as possible, right? Of course, it'll cost some people some jobs, but they'll have health care, and we're going to be shifting around other parts of the economy, so there will be jobs readily available for them. they can at least get a living wage, right, as a stopgap. The second argument to make is that it's, of course, cheaper than the private health insurance companies, because simultaneously, it reduces bloat yet again, right? Because when you have all these large health insurance companies, that are basically means tested, do you have a pre-existing condition? Are you covered by that? Are you covered by this? Can you afford this? Can you afford that? Are you going to an eligible doctor? They have to establish all these networks, between doctors. It's very complicated, right? There's a lot of that's why hospitals have such huge bureaucracies. It's because they have to deal with all this health insurance stuff, which affects, a lot of the back end of health insurance, pharmaceuticals, and all that sort of stuff. So if you force people, right, to get rid of their private health insurance by banning duplicative care, right, because that's what Bernie Sanders' bill does, is it bans duplicative care, meaning you can't sell private insurance for something that's covered under Medicare for All, right? So you could create some kind of advanced private health insurance that maybe covers like highly experimental procedures, only for the wealthy, some way of using inequality to push human society, right, by pushing more money into the healthcare system for research on top of, the rich people can, maybe live to be 200 or whatever science is going to do for us in the future, right? They can go once a year for their aging therapies, and while all us proles die down here at the bottom of society. But we'll have healthcare for all, so it'll be great. But so you do that, right? Because if you have single payer health insurance, it's literally just a single payer, right? It's a little bit more complicated than this, but basically, how it works is you just have like a single account, that gets charged when you go to a doctor. So you basically bring a credit card that charges the government account, right? And when you have something that simple, that streamlined, it's something that's very easy to automate, something that's very easy to implement. And once it's in, you're not getting rid of it. No one from Alabama, right, is going to want to give up their free, super cheap government health insurance. They didn't have health insurance to begin with, right? And now they're just guaranteed it, even in their, low, poor-paying, post-industrial jobs. But just to prove my point, here's an article from Jacobin Magazine titled "Medicare for All is Even Better Than You Thought," right? And here they discuss all the benefits of Medicare for All. Obviously, it has a bit of a bias with a name like that, but there's an important point section here I'd like to point out. One that is a big kind of argument for Medicare for All. It's one of the most common arguments that comes from the right is that, where are you going to get the money? Where are you going to get the money? Of course, for corporate tax cuts, they never ask where you're going to get the money. No, $2 trillion to the ultra rich. Woo, no problem. But $1 trillion to all of America. Ooh, that's just unacceptable. So the article reads, how much do we need to raise? In order to tackle the question of paying for Medicare for all, we first need to know exactly how much of it will cost the government. To come up with an accurate spending number, the PERI study takes two main factors into account. That demand for care will rise with universal coverage, bringing total annual healthcare spending up from $3.2 trillion to $3.6 trillion, likely a high estimate. That's what the article claims. I don't know. And that massive savings is administrative. Pharmaceutical and provider payment spending will then bring total expenses back down from $3.6 trillion to $2.93 trillion. So basically what this is saying is that what I already stated, right? So when you cut all this administration, brings costs down. Basically, you save $700 million by firing all these bureaucrats who don't know what they're doing. No offense to my bureaucrat friends out there, okay? But it's a disaster, all right? It's a disaster. Please don't send your bureaucrat hit squads after me. I know we operate like organized crime, okay? But please don't break my knees. Right, I'll sign whatever forms you need me to sign. Anyway, so continuing on, using $2.93 trillion as its annual target, the study then factors in already existing public spending, which accounts for over 60% of total health spending. See, pretty significant already. You just got to expand it. It's not hard to do. This includes spending for Medicare, Medicaid, and other public programs. Healthcare coverage pays for federal employees, and the $332 billion in tax subsidies the government currently pays to private insurance companies. It speaks for itself, right? We're already spending so much money, public money, basically subsidizing health insurance companies at this point, right, because of Obamacare, basically subsidizing the rest of the world's pharmaceutical industries because our prices are so inflated. They're able to deflate theirs lower because they have such large negotiating units, right? If the United States lowers its healthcare costs, the rest of the world is going to suffer. And that's a bit unfortunate, but let's, equality for all, right? Let's not pay higher premiums than the rest of the world just so the Europeans can have it that much better than us. Until, we're all united in the workers' revolution or whatever. Let's just finish up here. Altogether, public health care spending totals $1.8 trillion annually, which we can then subtract from the $2.9 trillion target. This means the government will actually just need to raise $1 trillion to fund Medicare for all. That is not a lot of money for the government to raise, okay? We just gave $2 trillion to the top, 10% of people? It's probably the 1%, but I'll say the 10% of people with Trump's tax cuts, okay? If we could reduce military spending a bit, we could stop giving these useless loans to dictatorships, right? We need a better foreign policy, one that helps people and forces governments to at least enrich their people, right? We need to figure that out, right? We can pull money from a lot of places. We could even just, as Bernie Sanders puts it, put a very small tax on Wall Street, right? That's his idea. And that would generate a ton of revenue because a lot of money flows through Wall Street, okay? A lot of money flows through Wall Street, and they will be fine. They're not going to go anywhere. People say the markets are going to go through the pipes. Trump said that today. No, they may drop. They may tank, right? They may tank because of the impending recession, but they would only probably see a bit of a drop, maybe a bit of a steep drop, but I'm sure there would be notice given that the pharmaceutical companies, are probably going to be, going bankrupt, and people would start to pull their money out before that. You'd need to create an easy transition for everyone involved. You don't want rich people ending up on the streets either, right? Because you destroyed their companies, but they probably won't. So just bear in mind that Trump here, or Bernie here, when he says things like this, he's winning us the election. He's giving us the mimetic power to beat the right. He's giving right, because the right wing finds this sort of shit offensive. That's the best part about all this. So Bernie is doing good work. I'm surprised this hasn't moved around more in the left community. In fact, it was quite difficult to find the source. Anyway, I'm your ombudsman, and I'm hoping to do more videos like this. I should start streaming sometime next week, so look out for that. You can follow me on Twitter, and I'll give live updates for when I start streaming, or you can follow me on Patreon, Twitch, or DLive. For now, though, I think I'm just going to start on YouTube, and then I'll start branching out, maybe doing some kind of simulcast. All right, stay honest, folks, and happy Monday.